Welcome to Mastering Vital Signs, Accurate Measurement Techniques. In this comprehensive tutorial, we'll explore essential methods for measuring vital signs accurately. Whether you're a healthcare professional, medical student, or caregiver, mastering these techniques is crucial for effective care. We'll begin by understanding the fundamental importance of vital signs. These measurements provide critical insights into a patient's health status, essential for diagnosing and monitoring various conditions. Throughout this video, we will cover everything you need to know, from tools required to precise steps and common challenges. By the end of this tutorial, you will have a solid understanding of how to measure body temperature, pulse rate, respiration rate, and blood pressure accurately. So, let's embark on this journey together, prioritizing accuracy and best practices. Stay tuned as we delve into each technique in detail, ensuring you feel confident and competent in your vital sign measurement skills. Each segment builds upon the last to create a comprehensive skill set for mastering vital signs. To ensure accurate healthcare, it's essential to understand what vital signs are and why they matter. Vital signs are measurements of the body's most basic functions, consisting of 4 primary indicators: body temperature, pulse rate, respiration rate, and blood pressure. Each plays a crucial role in assessing a person's overall physical health. Body temperature helps determine whether someone has a fever or hypothermia, both potential indicators of underlying health issues. Pulse rate, measured via heartbeats per minute, offers insights into heart health and circulation. Respiration rate counts the breaths per minute, key for evaluating lung function. Lastly, blood pressure measures the force of blood against artery walls, vital for cardiovascular health. Understanding these signs enables healthcare professionals, medical students, and caregivers to make informed decisions about patient care. In the next segment, we will delve into the tools and equipment needed for accurate measurement. Stay tuned. To accurately measure vital signs, having the right tools is essential. In this segment, we'll introduce the essential equipment: thermometers, sphygmomanometers, stethoscopes, and pulse oximeters. Each tool plays a crucial role in assessing different vital signs. Thermometers measure body temperature, while sphygmomanometers gauge blood pressure. Stethoscopes amplify internal sounds such as heartbeat and breathing, assisting in thorough assessments. Pulse oximeters measure the oxygen saturation in a patient's blood. Proper use and maintenance of these tools are key to obtaining accurate readings. Ensure each instrument is calibrated correctly and handle them with care to prevent damage. By understanding how to use and maintain these tools, you'll be better equipped to perform accurate vital sign measurements. As we move forward, you'll see how to apply these tools effectively in various scenarios, ensuring precision in every step. When it comes to measuring body temperature, there are multiple methods: oral, rectal, axillary, and tympanic. Each method has steps that must be followed for accurate readings. Let's dive into each method. For oral temperature, place the thermometer under the tongue and wait for the beep. Rectal measurements, often used for infants, require gentle insertion into the rectum. Axillary involves placing the thermometer in the armpit, while tympanic measurements use the ear canal. For each method, ensure the thermometer is properly sanitized and positioned. Let's discuss common challenges, like incorrect placement or unsteady hands, and how to overcome them. A steady hand and correct placement are key to accurate readings. Understanding these nuances makes all the difference in obtaining reliable measurements. Next, you'll learn techniques for measuring other essential vital signs, ensuring you're well equipped for various healthcare scenarios. Measuring pulse rate is integral to assessing a person's health. Pulse rate can be measured at various points on the body, most commonly at the wrist and the neck. To begin, locate these pulse points. Using your index and middle fingers, press gently on the radial artery at the wrist or the carotid artery in the neck to feel the pulse. Once you've located the pulse, use a timer and count the number of beats you feel for 60 seconds to get the pulse rate. Alternatively, you can count for 30 seconds and multiply by 2. Ensure a quiet environment to maintain accuracy. Interpreting the results is key. A normal resting pulse rate for adults ranges from 60 to 100 beats per minute. Be mindful of factors like stress or physical activity that might affect the reading. As we move forward, you'll see how pulse rate measurement ties into the larger framework of vital sign assessment. Now, let's delve into measuring respiration rate. First, observe the patient's natural breathing patterns without drawing attention to yourself, ensuring a more natural rhythm. Start counting breaths. One breath consists of an inhalation and an exhalation. Count the total number of breaths for 1 full minute. To ensure utmost accuracy, it's crucial to be consistent in your timing and methodology. Avoid distractions and double-check your results. Accuracy is paramount as a correct respiration rate is vital for assessing a patient's respiratory health. Now that we've covered measuring respiration rate, continue practicing these steps until you feel confident. Up next, you'll learn the specifics of measuring blood pressure accurately. Stay tuned. To measure blood pressure accurately, use a sphygmomanometer and stethoscope. Start by placing the cuff around the upper arm, ensuring it's snug but not too tight. Inflate the cuff until it tightens around the arm, then listen with the stethoscope over the brachial artery. Slowly release the pressure and listen for the first beat. This is the systolic pressure. Continue to release pressure until you hear the last beat, indicating the diastolic pressure. To avoid common errors, ensure the patient's arm is at heart level, they're relaxed, and they haven't consumed caffeine or exercised 30 minutes prior to the measurement. Recheck accuracy by taking at least 2 readings and averaging the results. As we move forward, you'll find practical solutions for common challenges in blood pressure measurement, ensuring your readings are always precise. When measuring vital signs, challenges are inevitable. Common issues, such as patient movement or malfunctioning equipment, can affect the accuracy of your readings. Let's identify practical solutions for these challenges. One frequent challenge is patient movement during the procedure. Overcome this by ensuring the patient is comfortable and giving clear instructions beforehand. Equipment malfunction is another challenge. Regular maintenance and calibration help prevent inaccuracies. Distractions in the environment can also lead to errors. Creating a quiet, controlled space can significantly improve measurement reliability. Improper technique can also skew results. Continuous training and adherence to best practices are key. By recognizing these issues and implementing solutions, we can maintain the high standard of accuracy essential for effective patient care. To ensure accuracy when measuring vital signs, follow these best practices, maintain consistency in your methods, regularly calibrate your equipment, and ensure proper documentation of each reading. Using the same method and equipment for each reading helps avoid discrepancies. Regular calibration of instruments like thermometers and sphygmomanometers ensures their accuracy, identifying and correcting deviations in readings. Accurate documentation enables effective monitoring and assessment of a patient's health trajectory. By committing to these principles, you're not just performing a task but ensuring the highest standard of patient care. Up next, we'll dive deeper into implementing these practices in your daily workflow and the significant difference they can make. Stay tuned. In summary, accurate measurement of vital signs is crucial for effective healthcare. By following the techniques and best practices discussed throughout this video, you can ensure reliable readings every time. Consistency and precision are key. Missteps in these measurements can lead to significant health implications, highlighting the importance of accuracy. As you continue practicing these skills, you will become more proficient and confident in your ability to measure vital signs correctly. Keep refining your techniques, stay committed to best practices, and always strive for precision. Your dedication to mastering these measurements plays a vital role in providing quality care. Thank you for joining us on this educational journey. Keep practicing, and you'll achieve mastery in measuring vital signs.